Welcome to this edition of COVID Ethics Update, a service for the Center of Practical Bioethics. Thank you for joining us today. My name is Danetta Sloan, and I work with the Center. Today, I am having a conversation with the Reverend Dr. Yvonne Delk. Welcome, Dr. Delk.
Thank you.
Dr. Delk is currently on the ministerial staff of the New Macedonia Christian United Church of Christ in Norfolk, Virginia. She is the former executive of Community Renewal Society of Chicago. She was the first Black woman to be ordained in the United Church of Christ and has served on the denomination in leadership positions, including serving as the director of his Office for Church in Society. She served as moderator of the Program to Combat Racism of the World Council of Churches. And for 50 years, she has served as an educator, a preacher, organizer, and a prophetic voice leading the fight for human and civil rights for people of color, children, and the poor throughout the 5 continents. She is the founding director of the Center for African American Theological Studies and also a member of the African American Advanced Care Planning and Palliative Care Network that's a part of the center's efforts to increase participation of African Americans in the advanced care planning process by working with faith communities. And I could go on and on and on. So thank you very much for your time today, Dr. Delk. So I just want to start just by saying, we all know that COVID-19, this world pandemic, has affected many areas of our lives through illness, death, social isolation, the mental health of those who serve on the front lines, loss of employment, and inequities in healthcare, with higher rates of death in our Black and Brown communities. We know that race is the variable that leads to poor outcomes, and this pandemic has only exposed further and amplified the disparities that exist. So, Dr. Delk, what I would like for you to speak to in the time that we have together is, from your perspective, how do we begin to address some of these symptoms? What type of leadership do you feel we need to enact change, the change that we need?
Thank you, Danetta. And I loved it that you asked me to begin to address this issue from my perspective.
Yes.
That means you've allowed me to bring my whole self to this table. Yes. As I respond. So I can address it as an African-American female who grew up in the red light district of Norfolk, Virginia, where race and gender and class intersect. And I can also address it from a vocation that I've chosen to live out with my life as a minister of the gospel of Jesus Christ. And from that perspective, I come at this from a vision of the world that God intends. And that vision of that world is a world of love, it's a world of justice, it's a world of community, it's a world of wholeness. So that when I address a pandemic, I bring all of those perspectives to bear on the issue. And so as I look at this time of pandemic, I'm clear that we need, as never before, solutions that are rooted in love, in community, in justice, and wholeness. I am convinced that we need leaders who can come at this issue from a holistic perspective. Whenever we are facing issues of life and death, and of course with coronavirus 19, the issues of life and death are before us as never before. Every morning when I get up and just see how many, we're almost at 90,000 deaths here in the United States of America, and the number of people who have it. We are facing an issue that's turning everything upside down, making you ask the question, what really matters as we approach this pandemic. And so I'm looking now for ministers. I'm looking for persons across a variety of perspectives who can ask the holistic questions of what it's going to take for us to navigate ourselves through this pandemic. I've always believed that if you don't define an issue properly, you're not going to solve it properly. And I think it's requiring us to bring everything we have to the table to address this issue. So I'm looking for leaders who can move at the intersections of this and begin to analyze and to offer solutions that help us to connect science with religion, that can help us connect public policy with wholeness, that can help us connect what we need to do with our own bodies, minds, and spirits in order to be safe, and what we got to work for in the society so that the systems are also working for justice and all that, in order that people can be safe as well. So I'm looking for holistic strategies. I know race plays an issue in this, and I also know that what I do plays an issue with this. If I got asthma, I understand how I got that asthma, but I also understand the pre-existing conditions that also exacerbates that asthma. So I don't want to be just treated for the disease. I want to figure out how we can work at the whole system to in order us to be as healthy and whole as possible.
Thank you. Thank you so much for that. What role do you see the church, the Black church playing, or is there a role for the Black church in helping?
And then I'm glad you asked me that question, mainly because I want to say that we got to stop for a minute and remember how the Black church came into existence. We got to remember the pandemic of slavery. We got to remember that in that early setting of slavery, when the church came into existence, it had to deal with several issues. One, help us affirm who we are as sisters and brothers and the people of God, to help us affirm who we are in our African understanding of wholeness. It had to help us live whole in body, mind, and spirit with dignity. So it had to address our spiritual needs, but also our mental needs, our emotional needs, our physical needs. And so the Black church had to look at it from a holistic perspective. The two issues that would be important were salvation and liberation. Salvation meaning, how do we in our bodies, minds, and spirits do those things that help us to be the most effective human beings that we can be, with an ethic of living our lives in love and wholeness and justice with one another. What do we need to do that? What personal qualifications and characteristics is it calling me to have? And my church helps me to develop those. But it's also asking, what's the nature of the community in which I live as well? And how do we enable that community, just as it wants me to be the most effective person that God intends me to be? It's asking the question, what about the communities in which I live and that I have to have my being? And it's asking, what's destroying the life of those communities? If sin has to be defined not only personally, it has to be defined systemically as well. And if the things I do that defy or deny me the opportunity to live my life as fully as I can, my code of ethics is important. The Black church tries to address that mentally, emotionally, spiritually, me as I come in. But it's also called to address that system outside of that church walls, the community. The church exists as a life-giving force for that community. So that means we got to ask the question, what's destroying the life of the community? What's happening when racism is still real? What happens when, in fact, sexism and classism keeps people from being that which God had intended them to be? So the role of the Black church is, yes, to minister to our minds, bodies, and spirits in this time of pandemic, to keep our spirits upbeat and alive, to help us figure out what we can do to protect ourselves and what we can do to help each other. But it's also got to ask the systemic questions of how do we continue to deal with those forces in our communities that destroy and deny life as well.
Thank you. Thank you. That's so profound. And thinking about a couple of things you just said, you talked about how we think about this, or how we think about the pandemic and how it's affecting our communities. Do you have a prescription or a model for how to look at this, so that we can figure out what those first steps are as it pertains to our a pandemic, or healthcare, the healthcare that we receive or don't receive, or the inequities in healthcare? Is there a way to look at this and figure out what is the first step that we should take, or how should we come together, unite as a community to move in a direction that we can enact change? Because these disparities have existed for some time, and our churches are the foundations in our community and the leaders in our community. So is it a way that we can come together, and how do we do that, and where do we start?
Well, the one thing about what this pandemic has done is interrupted business as usual.
Right.
Many of us are used to silo existences. We go into our little silos, our churches, and whether or not you worship in one faith and I worship in another faith, we worship in our own little silos. The pandemic flips it upside down. It caused us to come out of our silos, bringing with us our affirmations, bringing with us our ethics and our beliefs, but it causes us to come out into a community model, a way of saying, how do we all now begin to understand that if we are the solver, it's going to take all of us working together. It's going to take resources from a variety of perspectives working together. And so I, in a way, think that the shaking of the foundations that have allowed us to shut down our churches and have to come out into the world, into the community, to begin to talk with each other and connect with each other, begins to help us find ways that we can work together. We can't do this by ourselves. So
Right.
The model that I'm looking for is a community model, a model that brings a number of resources. Do we need doctors here talking about this disease? You bet we do. Do we need faith people here talking about the meaning of faith and hope and spirit in the midst of pandemic, how we survive, how we not allow fear to overcome us so that we begin to be anxious, but how we find a way to walk together in love and wholeness doing this? Yes. Do we need social services folk helping us to figure out how we gonna eat? Because the whole pandemic has turned stuff upside down, that people are out of jobs. They don't have jobs anymore. People don't have a steady income. They need food. So I've been looking at these food banks lined up, step by step by step by step, helping folks. We need to connect to that. Do we need to be thinking about what William Barber is talking about in terms of a way to end poverty and calling for us to address issues that cause people to be poor and get people out? Yes. Do we need to connect? And I just saw this on television this morning. I was so excited about one person who began to think about what's going to happen to the homeless who are out there on the streets. We can wash our hands inside our house. We can put on our mask. But what are those who don't have a home, who don't have a place to wash? This is a movement to get fountains out in the public where the homeless could go and wash their hands, distribute some masks in the midst of it. This is a time in which the community model is needed, a way where we see each other, the gifts that we all bring, and begin to work in community for the solutions. It's not just one strategy, it's many strategies that are needed. And my vision of the beloved community is when we can all see each other. You can come from your perspective. You can come from that place which you affirm. So for my Jewish sisters and brothers, I'm grateful to meet them. I'm Muslim, I'm grateful. My Christian, I'm grateful. For social services, yes. For the ones on the front lines, the doctors and the nurses, I'm grateful. For the bus drivers who are driving, who have to expose themselves. For the sanitation workers and those who are in. It's going to take community to work at this. And it's going to take community solutions. this is the time that I think that that African principle, I am because you are, and because you are, I can be also, means that's what we need, an interdependent, intersectional model that allows us to try to address all the spiritual needs, the emotional needs, the mental needs, the physical needs, and the justice needs that have to be addressed. And we got to be ready to deal with those.
Thank you. Thank you so much. Thank you for that. And what I want to loop into that, as a community, we come together as a community. Do you feel that Black and Brown people are now beginning to think about how the pandemic has affected us in terms of our health, and maybe rethink our health behavior? For example, have healthier diets, and maybe exercise to mitigate chronic illness, and maybe also engage in advanced care planning. Do you think we will now mobilize some of these resources around us so that we can make changes in our own life individually and as a community?
Let me say this. I think pandemics cause everybody to suddenly stop and ask some basic fundamental questions about life, about what matters, about what we've been doing, about what happens to us that helps our lives to be the best they can be, and what distracts us from that. It's about what can I do now to be the best that I can be, to help myself to live as healthy as I can be, as well as to think about what can I do with my sisters and brothers. But I know it causes you to ask some fundamental questions about yourself, about life and death. And I want to share with you a quick story about myself in the midst of a pandemic that caused me to have to face an issue that caused me to have to think about advanced planning. I hadn't been thinking about it. The year goes back to 1995, and I was very active, engaged in all kinds, as you already read. I was with the Community Renewal Society. I was working on justice issues. I was flying back and forth from Geneva with the World Council of Churches, doing any number of things. But I wasn't taking the greatest care of myself. I was moving, trying to help everybody else, but I wasn't taking time for rest. I wasn't taking time to really get myself in order, because I felt I needed to be in all of those places. Suddenly, in the midst of all of that, the rushing back and forward, suddenly in the midst of the stress and tensions of the job itself that I was doing, and trying to hold up the world solo, sometimes superwoman, right?
Yeah.
In the midst of it, I went into a staff meeting and never remember coming out. I had a TIA, a brief interruption of blood flow to my brain. I lost consciousness in this way, that I had no memory of the moment that I went into that staff meeting until I woke up 12 hours later in the emergency ward of a hospital. No memory for all of those hours. Suddenly, my whole system shut itself down. Suddenly, there was a blood clot that clotted it all up. And I wake up, I'm in an emergency ward of a hospital. And I remember two things about that. One, a doctor standing next to me, and two, a good friend who was a nurse who had accompanied me on the journey being next to me. And the doctor was asking me the question, do you know who you are? Do you know what day it is? Do you know who the President of the United States is? Do you know who you are? I couldn't respond. I'm here in this place, an emergency ward of a hospital. My world had been shut down, and suddenly I'm trying to make sense of it. And he kept asking me, do you know who you are? Do you know where you are? Do you know what day it is? Do you know who the President of the United States is? And suddenly, my friend, who was a nurse, who had accompanied me on this journey, understood that I was still in a state of confusion, said to me, Yvonne, you know who you are. You're Yvonne Delk. You're God's child. You know who you are. You're Yvonne Delk. You're God's child. And suddenly, in the midst of that moment of her calling me back to my name, calling me back to who I was, I suddenly began to be oriented again. I couldn't respond to the doctor's questions, which was sort of alien to who I was, but I could respond to her question about the essence of who I was, that I was Yvonne Delk, the daughter of Cora and Marcus Delk. I was the daughter of God. When I came up out of that experience, which took me a while to come out of it, suddenly I had to ask myself some fundamental questions about my life. I was close to death. And for a while, for 12 hours, I was dead to myself. I had not talked about death at that part in terms of me. I hadn't talked to my family about what I would want for anybody to do with me if I was at that point of death. I didn't talk to somebody else about all of those things that I wish that they would care for me when I was at that point of death. When I came up out of it, it caused me, that was my pandemic experience, it caused me to have to ask some fundamental questions about how I was going to live, but it also caused me to ask some questions about how I wanted to die. That was the moment that I decided I have been fighting for my right to be, to talk, to speak in all aspects of life. I have been fighting for justice, for other people to be heard, and that the principles that I lived by while I was living, I wanted to have those principles around me when I was transitioning into death. And I wanted somebody to know who I was. So that to know who I was to have an advanced plan, an advanced directive. Because I'm saying who I am when I say how I want to be treated when I die. Exactly. Just as I said how I want to be treated when I live, I'm going to say. And just as Linda Dodd, who was the nurse who was beside me, who kept reminding me of who I was when I couldn't speak for myself in that emergency room. I needed to have somebody, if I couldn't speak for myself, to know what I needed and to be able to speak for me even in my transitioning from life into death. For me, it was freedom to name, the freedom to decide how I would live, but yes, how I would, in fact, live in the midst of my final moments of transitioning from life into death. And you know, the way I feel, death isn't the last thing. We move, our spirits continue to move. And so how my spirit moved in those moments were important. I got my directive together at that moment. I got my person who could speak for me in case I had another TIA and wasn't able to speak for myself. I thought about what I wanted to say to people all around me and began to live my life now in the fullness. And that advanced planning gave me the opportunity to name who I was, my beliefs, and to live even in the moments of transitioning into death by those same principles.
Thank you so much for sharing your personal story. We have come to the end of our time. That was really, it was rich. And I'm so grateful that you decided to share the story with us, and so grateful for your time with us today. Are there any other salient points that you would like to make?
Let me just say this. One of the things that I think pandemics do is they cause us all to try to stand still for a moment and say, what's important? And what can I do? What is it that I have within my hand? What is it that I have the capacity to do? I've been so excited about seeing how people across all of these different lines are finding ways that they can live out their best selves and encouraging others, supporting others, standing up for others. Whether you got musicians singing songs of hope on television, or whether you got the police applauding as the nurses walk their way through, or whether you've got activists calling for justice and wholeness in the midst of the time, whether you got people like the ones I was telling you, making masks so that other folk can be helpful. People are reaching out to each other in ways that we weren't reaching to each other. People are calling me because they matter and I matter. We are being community in a way that allows us to reach and work for the best of all of us. And so I'm saying all of us have a role to play in that. All of us can figure out what we can do, the things I can do, the things you can do to make community whole. And in some ways, wouldn't it be something if out of the ashes of the pandemic came visions of wholeness, of love, of justice, community that brings down those walls of hate and division that have kept us apart? Wouldn't that be something?
Amen. Amen. Thank you so much. Yes, it would. Thank you for joining us today, Dr. Delk. I really appreciate your wisdom. I appreciate your sharing with us today. And to everyone else, thank you for joining and this edition of COVID Ethics Update, a service for the Center for Practical Bioethics. If you have any questions, ideas, comments, or suggestions for future editions, please email us at covid@practicalbioethics.org. Please subscribe to our center's channel or YouTube channel and sign up to receive COVID Ethics Update in your inbox at our website, practicalbioethics.org. Thank you again for joining us. Be safe and stay well.